Pedro Pita Barros. I'm a health economist at the Universidade Nova de Lisboa.
What made you become an economist?
Good question. Until today, I don't know. Just started doing it in a sense. So when it had to choose in high school, like many other people, I do it by exclusion of other options. And then I like it. And when I entered here to the school many years ago, I enjoyed it a lot. I decided to continue, and since then I'm finding it quite enjoyable.
Well, how did you end up in researching health economics? Was it a choice? Was it just happened?
Just happened. Yeah, I'm a lucky guy. Let's say. When I started my PhD program, I decided to take a period outside. So I went to Boston University at the time, and the idea was to work with someone that was supposed to be there that year. That person actually in that year decided to take a sabbatical leave elsewhere. So basically, I arrived there and said, what am I going to do? So I looked on the courses that were on offer, and one of them was health economics. There was advanced microeconomics that I wanted. There was a course of mathematical economics in the mathematical department. So I wanted to something that would fit nicely into schedules, and at the time was not totally disconnected from what I was doing. So I thought, maybe I was doing industrial organization, so I thought, let's see what is health economics. I go there, and it was applied industrial organization, the way it was given that course. So I went to the course. I did the course at the PhD level. It was really nice, and I learned a lot with that part. Then I returned. I finished my PhD thesis in industrial organization, and I started working in health economics.
What do you think is the most important, or what do you feel is the most interesting issue in health economics now?
Nowadays, the most interesting is still how demand is structured. What is the demand for health services, and how that translates into organization of health systems. Because the demand in health is totally different from other parts. I'd like to think about how to teach health economics to people is to say, okay, forget what you learn about demand, and let's see how we can deconstruct how demand is structured and see and all the problems that health per se brings to this demand structure. So health economics for me is pretty much understanding what is the demand for health and healthcare, and how we can influence that demand. Of course, there is the supply side, provision, efficiency, and so on, but actually knowing how people behave, how people react to the different incentives in the broad sense of economics, is actually still the center point of the things. And curiously enough, if you want to just read one single article on health economics, you can still go back to the Arrow 1993 paper, which basically still has it all there.
Yeah. How do you tackle a research question? What are the first steps you think about?
It's pretty chaotic. Goes back and forth. I don't have any particular method. It can come from an empirical side or from a theoretical side. It's maybe just something that I want to know how it works, and I want to get data and to understand it. And in that case, I need just to have a clear idea of the question I have in mind, and then try to find out what are the data that is available and what that implies for the type of approach that I need to take. Okay, so for empirical papers, in a sense, it's easier for this part. On the theory side, it's messier. Usually, I start with a broad question. I want to understand this part, and then when we start working, I start to discover things that do not go the way I thought they were going. It can be the modeling approach, can be the aspects that I neglected before that actually are important. And often with the theory papers, I go back and forth to the literature, go back and forth to reality. Does this match? This description of the model matches what we think are the main features? Not it's pretty random in the sense of steps. It can take longer. Sometimes I even try to have both a little bit of a theoretical model to understand what are the effects I want to capture, and try to get the data to see if I can match to that part.
Do you have any advice for a young researcher?
Have fun. No,
that's good advice.
But actually, it's more important than it seems, because research is a process of discovery, right? And the process of discovery means that you need to be devoted to it, and for people to have commitment to actually get to it, they need to have fun on doing it. Otherwise, it becomes a burden.